A few kilometers from Difa, Asaga camp houses hundreds of Nigerian refugees and internally displaced people from Niger, struggling to survive every day. You can easily find malnourished kids living among the wind, sand and tents. Mamadou is 1 year old, weak and hungry. His mother, Shatushiwa, is hungry too. With little milk, she cannot provide enough food for her boy.
Since his birth, we have been visiting the health center. When he was 6 months, they started giving him peanut paste. He is always tired and cries to eat, but I do not have enough milk.
According to UNICEF, about 12,000 children under age 5 will suffer malnutrition this year in Difa. Many will have to be treated at a center of intensive nutritional strengthening run by Mustafa Saleh. This doctor visits his patients every day. Some are only skin and bones, like this 3-year-old boy who weighs only 5.6 kilograms.
It is too early to know what the odds are for him. He arrived a week ago, very shocked as you can see. These kids do not eat enough. We need a tube to feed them.
Despite these worrisome scenes, there is no famine in Difa, nor in Niger as a whole. However, each year, this country in the Sahel region of Africa faces food challenges because of recurring drought and desertification, in addition to the threat posed by Boko Haram. According to the World Food Programme, 1.5 million people currently face food insecurity in Niger, lacking reliable access to a nutritious food supply. Back in Asaga camp, refugees say they have not received any food assistance for the past 4 months. They have nothing to do to earn a living and cannot go back home as the threat of Boko Haram still looms across northeast Nigeria. For now, Faloumata Boukar works as a community relay at the health center.
In the camp, life is difficult. We don't have enough food. Kids are hungry and have diarrhea. We brought them to the health center where they receive high nutrition supplements, but parents can't afford them. Our life back in our village was easier.
The coming lean period before the next harvest will likely bring a hike of malnutrition cases. Doctors here are used to that pattern since the start of the Boko Haram insurgency. Nicolas Pinault, VOA News, Difa, Niger.